I would like to acknowledge the Aboriginal and Torres Strait Islander people as the traditional owners of the lands on which we are all meeting. They're the traditional custodians of all the lands, waters, and skies that we live and work on across our nation. Today, I'm joining you from the beautiful lands of the Kombumerri people here on the Gold Coast, and I pay our collective respects to the First Nation elders, past and present, as our knowledge holders of culture, values, and law, and our guides into the future. I'm Dr. Mishel Shahid. I'm your host for today's webinar, which is brought to you through the Prevention Center's Emerging Leaders Network. Now, this network aims to cultivate a dynamic and enduring future prevention workforce that drives the co-design and mobilization of knowledge for policy and practice impact. So today, we also have a little poll for you. Karen will post a link in the chat, and if you could access that and answer which context you're joining us from today, research, policy, or practice, it would be great to get to know you a little better as well. So I think that link is now in the chat, and you would be able to access that. All right, so far we can see that majority are researchers today. And then we also have people joining us from a policy and practice context. So welcome everyone, it's great to have you. Now today's webinar will focus on the value of dynamic simulation modeling in prevention. And through this session, we will highlight how dynamic simulation modeling not only predicts future health outcomes, but it also helps us understand underlying systems dynamics and offers invaluable insights for policymakers and other stakeholders involved in the process. So the webinar will provide you with a deeper appreciation of the role dynamic simulation modeling can play in shaping health interventions and improving decision-making as well. And we would also like to hear from you again, whether you have had prior experience with modeling or dynamic simulation modeling or not, which will help our panelists today to guide the discussion through the question and answer session that we will have later on. So Karen will shortly post another link for that. The panelists that are joining us today to help us navigate this topic and understand it better include Dr. Danielle Currie, who is a systems dynamics modeler, and she's the co-director of decision analytics at the Sachs Institute. She has a background in environmental management and public health, and her current work focuses on creating user-friendly dynamic simulation models to help decision makers gain insights on the systemic drivers of complex public health problems. We also have with us today Professor Tony Blakely, who is an epidemiologist and public health medicine specialist. He's committed to answering questions about which public health interventions will achieve the greatest improvements in health and social outcomes, reduce inequalities in health, and do so cost effectively. Now, we stopped sharing that, but I could see already that a lot of people have not had experience with dynamic simulation modeling. So our panel here today will help you understand this better. And last but not the least, we also have with us Adjunct Associate Professor Joe Mitchell on the panel, who is a former public sector senior executive with expertise in prevention policy, and the delivery of prevention services and programs. And she has significant experience in policy relevant research, purchasing, performance, and workforce development. So welcome to our esteemed panel. Thank you so much for joining us today, and to all the participants as well. Without further ado, I will now hand over to Danielle, who will go through a quick introduction to the knowledge synthesis on modeling of on dynamic simulation modeling that was released at the end of last year, and that will help us navigate this discussion as we move forward. So over to you, Danielle. Karen, if you could just share.
Yeah. If you don't mind sharing the slides, Karen, if that's possible. I apologize if I get a bit choppy. Again, my NBN is not doing so well after being partially flooded by a cyclone. So I'm hoping I stay with you all with you. Karen, are you able to share the slides?
We can just waiting for those to go into presentation mode, Karen.
Beautiful. And if you can just skip through the beginnings, Mishel wonderfully did the acknowledgement of country for me, so we can move through. And we're just going to talk a little bit quickly about the knowledge synthesis that was done over the last, I think, about 6-ish months, where we looked at the work that the Prevention Center has done over the past several years in dynamic simulation modeling, and to kind of look and see what were things that we could have learned from the process. And so just a quick recap of the knowledge synthesis, the objectives of knowledge synthesis. It's really to look at to synthesize all the evidence from past and current projects that the Prevention Center and the CERI have funded or been involved in, and then combine that with policy and program expertise from policy partners of the Prevention Center to see really what can we learn from a policy perspective, how can we summarize it and bring it together from a policy perspective. And so really synthesizing all of the findings from those studies and hopefully communicating them in a way that's perhaps more accessible. Thank you, Karen. And so really the process that we used to do this knowledge synthesis, looking at the work that was done within the dynamic simulation modeling kind of area, is we started brainstorming and mapping kind of what were the different things that we learned from it, developing the key questions that we would use to undertake the knowledge synthesis. Then we discussed with the policymakers the key findings and implications, and then we finalized those outputs. So if you want to keep going through that one, Karen. So really the main question, or the thing that we base the whole knowledge synthesis around is these two research questions, and not only the synthesis, but also the policy dialogue sessions that we did. And really we wanted to focus it on, in what ways can or does dynamic simulation modeling add value to the chronic disease prevention space? And then what factors might constrain the ability of a DSM to add that value? So we really wanted to not necessarily focus just on what the findings of each of the projects were, but really as a process, what does this bring to the policy space, as well as what are the things that might bring challenges to its use in this kind of policy environment. Thanks, Karen. So when we talk about what models or what products we reviewed, we really focused on any type of simulation modeling that goes beyond that static representation of a system and incorporates some level of time dynamic changes, which is the dynamics in it. So we really focused on 4 types of models that had been done within the Prevention Center kind of sphere. Those are system dynamics models, agent-based models, discrete event simulation models, and then hybrid models of those combinations. And I really do wish we had the time to really talk through what these different types of models mean and what they are and weigh them. But unfortunately, we don't have time to do that. So that's all kind of broken down in the report that I hope you guys will all read. And so we looked through all the projects that were funded through the Prevention Center between 2015 and 2024. And through that, we identified 14 projects. So quite a lot of work was done. And it was a really broad range of different topics, from alcohol to childhood overweight and obesity, to pregnancy-related diabetes, a whole bunch of different types of models. And so for each of those projects, we reviewed what were the key insights produced through the process, as well as we then spoke with individuals who work on those projects to get a sense of what were some of the challenges that arose in the process and get a better understanding of what were things that may have constrained the kind of ultimate insight potential of that modeling process. Thanks, Karen. Yeah, you just click all the way through. So from that, what were the products that came out of this process is we have this the synthesis report that is available on the Prevention Center website, as well as a summary of what are the key learnings from it, as really focusing on what are the key types of insights that we can pull out of dynamic simulation modeling process. And the one I hope that is used the most is really this practical guidance for policymakers on whether dynamic simulation modeling is right for you. Because I think one of the things we found in going through this process is that dynamic simulation modeling isn't the right tool for all problems. And I think we'll talk about that a little bit in the panel discussion. But it's really going through a set of questions to make sure, is this the right type of modeling for you? And is this the type of modeling for which you will get the insights that you actually are after, that fill those policy gaps or holes that you face. So there's a kind of a practical guidance document that we hope will be used by policymakers, as well as anyone who's interested in potentially using dynamic simulation modeling to help really triage and see, is this the right approach? And if it is, what can we do to make it more insightful and make it more powerful and make the fit correct? Thanks, Karen. And so the big thing that came out of this, and I do hope everyone reviews the report, but the big thing that came out of this is that when we think about dynamic simulation modeling, or we talk about, and it's not even really just dynamic simulation modeling, it's modeling as a whole. People often think of it as a tool for prediction. It's a tool that we have a question that we need to know what's going to happen in the future, and so we can use modeling to get those numbers. But after consulting with individuals who worked on the projects, as well as people who use the outputs of those projects, we uncovered 10 different types of insights that are things in which simulation modeling can add to the policymaking process. And these were all beyond prediction. So these are the 10 types of insights that we really were able to glean out of the different projects. And the first is descriptive insights. So really ways to help the people involved in the project really understand or characterize the data and information about their problem. Just being able to understand what is happening in front of them. Modeling was also able to provide explanatory insights. So really helping provide information and understanding about what is happening in their system, and explain kind of the processes that they see in front of them. The next is diagnostic insights. And this is one that I really feel quite passionate about. Is it really helps identify what are the problems within the system and what is those problematic behaviors. So if something isn't working, it helps answer some of those why questions. And if you can think of, when you think of models as prediction tools, you don't necessarily think of it as telling you why, as opposed to telling you what will. But there's great value was found in being able to better understand why things were the way they were. The projection and prediction insights are really the obvious output of many types of modeling. Another really interesting one we found was these gap identification insights. It often takes a lot of data or information to build a simulation model, whether it's a dynamic simulation model or a model in general. And they're a great way to understand what data you don't have, or what information or understanding you don't have. So that in and of itself is a very valuable thing within the policy space. And the last ones, are prescriptive insights. So that's one that often comes up with dynamic simulation modeling. Should we do A, B, or C? Which is an optimal option or strategy going forward? They can also help with being able to communicate really complicated topics. And we saw that in the context of COVID, really complicated topics. It helps distill down what is important and what are the things you should know. They're a great tool for capacity building. They're a great tool for consensus building and stakeholder engagement. So bringing that shared understanding of a problem amongst a wide variety of stakeholders. And lastly, contextualizing insights. So we found that they're really helpful tools to be able to understand what is the potential reach or extended impact within a wider system context. You have clinical trials, for example, that are able to focus on a very small and controlled system. But when you try to apply the effect of that to a large population, what is a realistic impact when you apply to the population level? Because we know it doesn't just scale up. Thanks, Karen. And so just before we embark on having kind of a discussion amongst Tony, Joe, and myself, the other thing that was kind of important to, I guess we can skip this step because this kind of goes through, I've already explained all of them, so we can skip through these ones. Sorry, Karen, got a bit ahead of myself. One more, Karen. Yeah, and so again, the last thing that I kind of wanted to talk about was we also identify what were some kind of practical things to consider for policymakers when they're deciding whether or not to embark on dynamic simulation modeling. And these are really outlined again in the report, but the main messages that we kind of were able to glean out of the process from both a practitioner and a policymaker perspective is the importance of clarifying the objectives and understanding why you want to model and what is it that you really want to get out of it. really kind of focusing on what is the policy issue that you're trying to change, and is this something that modeling can actually support? Really thinking before you start a modeling project about what is the actual insights you're looking for. If we think about the 10 different types of insights that are possible, what are the ones you're looking for, and what type of modeling can best support it? Really focusing on how you intend to use the model and its outputs, because the type of modeling you're selecting really should be based on how you intend to use it. Are you intending it to understand a problem better, or do you just need to know how many beds you'll need in 2 years? And that really matters. You need to consider the engagement and participation level that you want, as well as that your stakeholders around you are willing to give. Really need to think about the availability and quantity and quality of data, as well as the importance and of potential for you to embed yourself in the modeling process. If you're not able to embed yourself in the modeling process, you'll get far less out of it than being able to really be deeply embedded in the modeling. Being realistic about the time and resources that you have to do modeling, as well as ensuring that you're using it as a decision support tool. It's not a crystal ball. And then being really prepared for it to be an iterative process that, it's not a one-stop deal. It takes kind of really a long kind of chain of iterative cycles of modification and growth to get a really good value out of simulation modeling. So those are kind of some of the things that we have, and we do hope you'll explore the report more. But what we really want to focus on for this hour that we have you is being able to discuss amongst all of us, and hopefully led by Tony, Joe, and I, where does this DSM sit, or where does simulation modeling in general sit within the policy space? So I think that should be the end of the slides, Karen. Oh, and here is the if anyone wants to take a snapshot of the report, but you can also find it on the Prevention Center website.
Oh, thank you, Danielle.
Back to you, Mishel.
Thank you. I've also added a link to the report and the different products in the chat, but thank you, Danielle, for that brief summary of the report. That was really insightful in setting the stage for the discussion that we will now dive into. So just for the audience, I encourage you to add your thoughts using the chat function to the conversation as we go along. I'll moderate the chat, and if there's anything that you want to say to the panelists or any experiences you want to share that you've had with modeling or increasing the understanding of modeling, then feel free to do so. And then we'll also jump into Q&A towards the end, where you can use your mic or cameras to ask those questions as well. So for now, Tony, Joe, and Danielle, I would like to direct my first question to you, which is collectively to all of you. And this is, how do you see dynamic simulation modeling really complementing existing public health research, policy, and practice, particularly when it comes to decision-making processes for policy development? And so for this one, Tony, if you would like to kick off.
Thanks, Mishel. I'm actually just going to first of all deepen some of the things that Danielle's saying, and I won't share my slides yet. I'm famous for arm waving, so here we go. Dynamic simulation modeling. What is it? Well, in the report, they talk about 3 examples: agent-based modeling, system dynamics modeling, and discrete event simulation. I'm going to try and explain what they are in brief terms, because I know when you come to this, you think, well, what the hell is this? And particularly, they've said dynamic simulation modeling and system dynamics modeling. How do they do it? Okay, let's go one by one. Agent-based modeling. Think about the pinball machine that you used to play on. Now imagine there's lots and lots of balls in it. They're each the different agents. They go whizzing around in a 2-dimensional space. And when they bump into each other, they'll make a noise, but they might also transfer a virus between them or transfer some information between them. So it's like all these agents moving around in space over some time step. Agent-based modeling requires a lot of data, increasingly used in infectious disease, and I'll come back to that. Discrete event simulation is kind of what it says. Now, to back out of this, some of you know what a Markov model, that's the discrete time step model. So normally you'd have a Markov model with, say, a day or a year-long thing, and they stay in that state for a day or a year or whatever, and at the end there's transition probabilities, and they go shoot off all sorts of places. In a discrete event simulation, each person, so it's micro simulation, each person has a time to the next event. The next event might be dying of their colorectal cancer, or getting to the surgeon first for their colorectal cancer, or dying of something else. So what you do is you work out probabilistically which event occurs first, and you just jump to the next event, so you've not got time steps in it. Discrete event simulation, it's a micro simulation, very good for detail. It's also got a thing where it's really good with queuing. So if you've got a limited resource of colonoscopists, and you increase your screening program participation by 5%, that could do really bad things to waiting times if you're at the cusp. Okay, system dynamics modeling. Now, Danielle's much better than this at me, but it's got more of those feedback loops in it and happening in there. And I won't say any more because Danielle may want to jump back in there. Now, just 2 more points before I show a slide. I hope this is okay, everyone. I want to embellish some of what Danielle's said. So I'm going to use the COVID. We used an agent-based model, so pinball machine for COVID. And 2 things that it did. First of all, I was part of the group, but I wasn't allowed in the room because I was too naughty. I might speak to the public, but we worked with the Victorian government. I was outside the room, too dangerous. But inside that room, Brett Sutton, Alan Cheng, the Victorian people in that second wave in Victoria, so thinking, I think it was about August, September 2020 from memory, they were playing with the model and really, really thinking hard about whether or not they could re-eliminate the virus. And they did, off the back of using that model and playing with it to really get a deep understanding so that those experts were empowered. They had their normal knowledge, but they were empowered with having had a chance to play with a tool. So that's the exploratory stuff. And also on another one, on the embedding with policymakers, on another exploratory one, sometimes a model's work really well if you get a surprise. And then when you think about it, you go, oh, that's bleedingly obvious. Here's the example. We did a modeling of mask wearing in COVID, and it didn't make as much difference to the cases as we'd expect, which took us by surprise. But when you thought about it, every time somebody goes home, they take their mask off, and so they're still getting infected in the home environment. We were telling people to put masks on when the infection rate was high, and then they'll take them off when it comes down again. But the virus will just keep spreading for longer. So what it did was it shifted where the infection occurred. So we got a lot of understanding about that. Right now I'm going to do what I was supposed to be doing, which is share my slides. I've got Mishel laughing at me. Right, here we go. Let's get this thing working. I just need to toggle back to do the share thing. Here we go. This should all work now. And there, Mishel, is that somebody can say if that's sharing correctly?
Yes, that's great.
All right.
Thanks.
So this is back on what I was supposed to be doing. So we're going to just pull back a little bit here and answering the question that Mishel asked us. I'm going to strike out the word dynamic simulation first and try and answer the questions, how do you see modelling complementing existing public health research policy and practice, particularly in decision making? I just want to pull back and make some general comments for those of you who are trying to orientate yourself to the field. Lots of things determine policy decisions. Social license, ideology, whether we actually have the widget or gidget or not, what people value, politics, all the rest of it. But some of it will be the actual things that we think matter, which is the health gain, reduction in health inequalities, changes in health system expenditure, and maybe some other things like workforce productivity. I'm now thinking more about NCD stuff here, if you can find people to model that robustly. Another couple of points I want to make, and I'm going to be a bit provocative here, but I hope you get the point. Systematic reviews, whilst essential, they are so last century. I mean, it's like, goodness me, you do not get policy out of a systematic review as a rule because it's just one input into a system. So increasingly, I think, as far as systematic reviews or information for policy, the systematic reviews we're used to, they're just one input on the effect size or on how likely they're to increase screening over here. But there's lots of inputs into the modelling that we want to be able to model or speak to what a system or policy change might achieve in terms of the things we matter to us, like health gain, health inequalities. I used to describe myself as being in the business of SQS, structured quantitative speculation. That's what we do. We do SQS. But if you think about it, modeling is the best way to do that because you can do the whole system if you've got the data to put in and if you've got the finesse and ability to pull stuff out. Now, I'm not yet talking about dynamics systems modeling. I'm talking about modeling generally at this point. And it would be even better if when we do modeling, if we're into the prediction part, saying what we think will happen with health gain, what we think will happen with health expenditure, you want to do that entirely comparably so that when you do it for a tobacco intervention, a salt intervention, a screening program, you can give the same results and rank them correctly for the policymaker and the public for that matter. But it has other benefits to modeling. So someone who's used to modeling, an SQSer, if you like, you're quite good at thinking fast on your feet because you're used to thinking about how all these things come together. You can't anticipate everything. I kind of didn't quite get the mask thing right, but then I understood it. But if you're good at doing that, then you can be quite good at providing advice in the heat of the moment, like COVID. And you can also work with policymakers by playing with the model. That's the example I gave you with Alan Cheng and Brett Sutton and really digging in as they were thinking about, can we eliminate during the second wave? Right, now to the question about how do you see dynamic simulation modeling complementing? So this is the agent-based model, system dynamic model, and discrete event type thing. It's just one area of modeling. So there's still the old Markov models. We use proportional multi-state life-table models. There's a whole range of models you can use. And as simple as this decision tree may be all you need for a particular issue. By dynamic, it means that you've got your pinballs interacting with each other, and you've also got interactions with the environment. So, for example, the chance of being infected or becoming obese or drinking alcohol is a function of both your personal attributes, the sort of fixed things that are pretty static, but also the environment, which is the prevalence of infection, which changes based on all the individuals or the density of fast food and alcohol outlets, etc., etc. So that's where the dynamism comes in. And you can also have emergent properties coming out of this model. So, for example, if people start drinking a lot because you get into a sort of tipping point, that might feed back to change the policy environment on whether or not we're going to allow more alcohol outlets into our neighborhood. So you can get these types of multi-level dynamic feedback loops in there. I've already talked about the queuing one, so I won't labor that again. It's just discrete event simulation. For the only thing you remember from today is just remember follow the way that is quite good for dealing with queuing phenomena. There are costs, and Danielle's already said this, is you need more data for this type of stuff. They're harder to calibrate, they're harder to validate, and it may take time to build them, although sometimes you can get a platform ready and be able to respond quickly to policymakers. I'll stop there and unshare and stop speaking to give other people a chance.
Thank you, Tony. That was a brilliant, comprehensive explanation of all the different kinds of models and the differences between dynamic simulation models, systems dynamics models, and all those terms that tend to confuse people. What I particularly noted is in that last point for systems dynamics models, you have rightly pointed that they're harder to calibrate and validate, and this can be quite challenging when you have to make policy decisions and you have to, relay that to your senior executives and decision makers if you are part of that modeling project group. So, Danielle, I'll ask you how you have navigated that, having worked closely with some policymakers in the projects that you have done for modeling.
Thanks. And I think Tony's not wrong that dynamic simulation modeling on the spectrum of modeling does tend to be on the higher end in terms of time and resources needed, the amount of data and the number of insights and evidence needed to feed into them. It's definitely not the type of modeling that you want to go for when you know very little about something and you have almost no data about it. It's not necessarily sitting in that one place. But I think that doesn't necessarily, because it's one of those more high intensity, high need types of modeling, that doesn't mean it's not worth it. It's not worth doing. It's not worth kind of a path worth pursuing. It is just one of those things that if you're going to embark on that path, it's important to know, to do those kind of questions and think about, is this the right type of modeling for us? And if we are going to do this, what are the type of insights I'm looking to get out of it? Or what are the holes or the gaps that we're trying to fill? Because when I reflected a little bit on your, on the question you asked, Mishel, I quickly put together, I'm going to share my screen. Hopefully the NBN still stays with me here. And hopefully you guys can see it. But within the policy space, there's there's always a set of gaps that exist within the policy space. And within every policy question, whether all of these, they don't all exist for all questions, but they are the type of gaps or needs that exist within policy. And when you're trying to answer a question, there's sometimes future uncertainty. We don't really know what's going to happen if we do something into the future. And so there's a hole that needs to be filled there. Or maybe we don't have a good causal understanding of what's causing, what's making this happen, or even what is the problem. Something didn't work, but we don't know what it was that made it not work, or we don't know which action to choose, or we don't know how uncertain we are with the evidence. And so I think within the policy space, if you go in first understanding what are the gaps that we're trying to fill, then it can help make that decision of, is this the right type of modeling? Is this the right process to go for? As well as when you're trying to judge the value of the modeling at the end, we judge it less on I think the predictive value of models is important. It's important to know the predictive quality and the uncertainty around the outputs of model, but also, did the modeling process add to these particular areas as well? And if it did, that's kind of a value proposition of modeling. So what are the value propositions of it? Well, perhaps it built the systems thinking capacity. And I just love what Tony said about, the people the more people do this, the more you become, and I can't remember the term you used, Tony, was, but a quantitative speculator.
Structured quantitative speculation.
Yes, a structured quantitative speculation. The more you do that, the better you get at doing that in other contexts. And it kind of starts to form that systems thinking and that systematic way of thinking as you approach problems. And you build that capacity. You make decision makers more ready to think about what are the broader consequences and broader impacts of it, and what are the right ways to approach questions. Even just that, what is the right way to approach a question? And am I balancing this amongst the right things when I'm looking at the value of assault reduction intervention? What am I comparing it to? And what is the magnitude of change, and really getting those questions going? So I think going into it, there's kind of really a large range of ways that dynamic simulation modeling and simulation modeling in general, or modeling in general, can really support the policy process by filling some of these gaps. In addition to prediction, there's incredible value in being able to improve the way people think about problems, get a better understanding of what's causing that problem, and really being able to bring people together into kind of that shared ownership ownership of a problem. And I think that's where dynamic simulation modeling shines. It's not just in predictive capacity, is that it brings this portfolio of different insights it can bring to the policy process.
Thanks, Danielle. Definitely, I've heard that it is quite that shared understanding that really helps facilitate the decision making as well, and having that ownership of the problem and solutions that come out of it. So, Joe, I'm wondering from your policy perspective, what are your thoughts as you reflect on what Danielle and Tony have said so far about how modeling can support or complement decision making in the prevention policy space?
Thanks, Mishel. And look, my perspective is from inside the room where those decisions get made, or some of those decisions get made, not all of them, of course. And the three things I wanted to just mention here, which build on and are parallel to what's already been said as well, is that from a policy perspective, it's really useful. Modelling is a really useful way of synthesising the evidence and to help make decisions. And it's about the likely impacts, as others have said, both individually and combination. That's sort of what makes it really helpful for policymakers. As others have said as well, the process, if it's done in a collaborative way, participatory way, the process builds that shared understanding, but also trust in the model. And I used to like calling it, it's like the participatory process means that the model becomes a glass box rather than a black box, because you know what's in there, you know what some of those assumptions are. And having that visibility and understanding means that there is more trust in the process. And on that issue as well is that one of the things in some of the modelling that I was involved in, and it's probably a useful reminder as well, is that who's involved also builds trust. And so I'm thinking of a particular example where if you're trying to influence the decisions of the next level up in the organisation as well, it's really important to think, who do those people trust in that process as well? Who do they trust to be able to interrogate and to have those really robust discussions with the modelers, with the researchers, so that there's that sort of sense of understanding of A, the policy context, but B, how the system works as well. So it makes it much more tangible and real. And so if you get the right people in that process, it's much more likely to be taken and taken seriously and trusted as well. So that participatory process, I think, is incredibly important from a policy perspective. The third thing I wanted to mention as we go into more detail in subsequent questions is that it's really the interactive nature of the model that really makes it very compelling because it's a different way of seeing evidence and it's visual. And it sort of provides powerful, you can use it to show different scenarios as well. And you can see when people are, being exposed to a model, how it captures their imagination. So it's a bit like Tony's saying, people like to play around with it. They like to sort of see, if we do this and we do that, what's the impact, etc. And so that is very powerful, again, in terms of it could reinforce your expectations of what might happen, but also raises questions of, that's interesting. I hadn't sort of anticipated that would be the case. So they're my sort of 3 introductory remarks.
Thank you, Joe. That's really great to hear from you. But also that makes me wonder, how do you think then these dynamic simulation models can really inform or support policymakers, particularly when you are juggling with constraints from political influences, changing policy cycles, as well as resource constraints. So I wonder if you have any experiences to share around that for us.
Sure. I was very pleased, very privileged to be involved in 2 of the modelling processes undertaken by the Prevention Centre, and in fact the first, which was a model around alcohol. The second was a model around childhood obesity, and the context for both of those were really different. So with the alcohol model, the focus, it was a new portfolio area that had come to my sort of area of responsibility. And it was a new approach which had come from the Prevention Centre as well, saying this might be something that you're interested in. And so, the impetus really was, here's something new and interesting for a new policy area. And it was an opportunity to both learn about modelling, but also get a better understanding of the prevention elements of the in the alcohol space. I think thinking about the learnings that have come, or the lessons that have come from the knowledge synthesis. In retrospect, I think that we didn't have a very clear question that we wanted to ask. What we wanted to do was to, play in this, new and exciting space. New and exciting for, chronic disease prevention, probably not in other areas of public health more broadly. And so it was more of a curiosity approach. And I think that the reality in that space, in that particular project, is, we created something that was really interesting, but probably the thing that was most beneficial was that we engaged with the clinical leaders in that area. We built those relationships because it's a new group of stakeholders who also learned something new, and so it was a very positive relationship building approach. Whether it actually gave us anything that sort of helped make change in policy and practice, I don't think so, but there are those other benefits, and it was a bit experimental, and it was sort of more from that perspective that it was beneficial. Part of the reason for it sort of not really impacting the work that we were doing so much is that it wasn't sort of necessarily focused on a particular issue that we were wanting to solve. It was much more explorative. And at that time in New South Wales, which is where I'm based, there were some new government policies like the lockout laws, etc., and closing times of alcohol bottle shops, for example, and those decisions were made for political reasons, and so the model included, the kinds of impacts about those and the lockout laws, etc., and what would make a difference. But there was no appetite in government to actually be thinking about that because the decisions had already been made. So it was interesting, but not impactful. Although having said that, it also, it did contribute to the knowledge base. So it's not that it wasn't useful. The second example is one where there was a Premier's priority to address childhood obesity. So there was a really strong authorising environment. It was an area where we were being, scrutinised quite a lot from the powers that be about, how well we were progressing towards this target. And so from the Premier's priority perspective, we were very clear about why we wanted to do this. And it was like, can we meet the priority? It was very ambitious. And what was the best mix of interventions to help us to do that. And so it came from a very different perspective. And because of that, it did actually create information, evidence to support some of the interventions that we were doing, or also the priority on which we were focusing on those interventions. So I noticed in the chat, I think it was someone called Monica, you asked, have these processes actually created some change? And in this particular project, yes. What we were able to do was, because we had a question about, we had some school and early childhood centre-based interventions that were already in the field. They'd been in place for, some 7-10 years or so. So the question that we're looking at is that we had high reach. So 80% of both of those settings were working in, part of participating in those programs. We had a series of indicators or, practices that we wanted those sites to adopt. And we knew that we currently had about 70% adoption. So when we looked at the model, we saw that if we increased the reach from 80 to 85%, and if we increased adoption from 70 to 80%, we'd get a small but meaningful impact in terms of contribution towards the target, and so it helped us to reinforce that it was reasonable for us to be increasing the KPIs for the local health districts to meet that sort of stretch, and that it was going to make a difference as well. So that was quite helpful. But the other thing in terms of what was different too is that it did make us, some of the things that went into the model, because it was a participatory approach, it wasn't determined by the department. It was, it included, perspectives from other players, and so it did bring in some of the food policy or the advertising and tax on sugary drink, for example, which aren't part of the responsibility of state government. And so it showed that would make a difference, that would certainly contribute, and we kind of needed that to really get us to the target. But the area that gave us a bit of a surprise was the particular potential contribution of work on healthy built environments, so environments that support physical activity, as well as, in the sport and rec setting as well. So that sort of gave us another angle for us to be, pursuing with others as well. So, I think that, just bringing that to a close then is that because we had that high level scrutiny from, Premier's office as well as the Minister's office to meet those targets, there was that interest in engagement, and it also felt like a really fresh way to be able to present information that we intuitively understood from our understanding of the static evidence that these are, that this mix of strategies was required to be able to meet such an ambitious target. But certainly the academic process helped build the credibility, even though some of the options weren't on the table and we knew would not be on the table as well. But it did broaden that perspective around, that it's not just one thing that's going to make a difference here as well.
Thank you, Jo. Thank you for that insight into things from the decision maker perspective. Tony, I'm wondering from your perspective as a modeler and an epidemiologist, how do we navigate that participatory approach in building those relationships to ensure that these elements are incorporated. And as Maria has put into the chat, did any of the models that we reviewed, but more broadly, I wonder, is it possible to incorporate political influences or public opinion that could hinder policy adoption implementation into these sort of modeling processes?
So there's two questions in there. On the first question, I haven't done modelling that includes the probability of Trump suddenly arriving on the scene or other political influences. That is quite complicated to include those much higher level disruptor events. On the more general issue of building a constituency or being modest, not my strength, but being modest, is I think Kingdon's framework on multiple streams to policy making is quite useful here. So 1970s, somewhere like that. And it's pretty obvious when you think about it. It basically says policy happens when we agree about the problem. By we, I mean the academics, the policymakers, and the citizens who vote in the politicians. We have agreement that there's a problem. We have agreement, or at least we have options on what the policy option response can be to that problem. And the decision makers, be they the politicians or people enabled by the politicians, are ready to act. And in that framework, it's really bleedingly obvious when you think about it. We, people like me, modelers, we are what they call policy entrepreneurs. We're the ones who are thinking about the problems coming up. We're thinking about the policy, and we're trying, the way I see it is that we're trying to actually model some of this stuff, thinking that in 2 to 5 years' time, this could well be on the options list and be able to be done. So you're trying to anticipate that. And what you're doing is you're trying to get, well, this is the way we approach it, trying to get out lots and lots of different policy response options that are comparable, and they're there ready to be picked up. And you're pushing that out through things like blogs. You're not trying to tell people to do this. That's not our job. I'm not, there's two things I'll advocate for, to back up, no, three: tobacco control, gun control, and elimination when it's SARS-CoV-2. But the rest of the time, I'm just an academic. My job is to provide the best possible advice I can on what the benefits and costs will be for society through its decision-making apparatus, in our case, through the politicians and the policy people to make the decisions and inform that. So I hope that gives some idea. I see myself as a policy entrepreneur in a system where I shouldn't and I don't have complete control over it, but I'm trying to get information on the decision-making table, so at least the discussion starts from some numbers, as well as the very important ideology, social license, etc.
Thank you, Tony. I really like that term, policy entrepreneur. So that's
and also,
great.
just a plug for the Sachs Institute, there's a report that Helen Signey did, and she talks about knowledge brokers. I also really like that. It's a good report for people listening on the Sachs Institute thing, on the partnership thing, by Helen Signey. It's really good.
Thank you, Tony. I'm conscious that time is flying, so if the audience members also has any questions, do feel free to raise your hand and ask away while we still have the panel here with us. So while we wait for some questions to arise, I want to know, Tony, from you again, how do you think we can best get equitable outcomes from these models, particularly when we consider priority populations? And is there a good approach to that?
I'll tell you the approach I take. And there's been a long story to this. So I initially started my career leading health inequality research stuff. And when I moved over to modelling, I had my old mates knocking on my door and say, Tony, why aren't you modelling income replacement? Tony, why aren't you modelling it? Because the chain of causation is so long, it's hard to do it. But again, only speaking for myself, but what we then do is we try and split our populations by sex and age, but also by socioeconomic status and ethnicity, and then work out what the health effects will be on them, and then you can work out the closing of the gap. So let me give you an example, which also addresses Monica's question about were any of the interventions effective in the NCD space. So we were commissioned by the New Zealand government to look at the tobacco endgame as a crazy idea. 95% reduction in retail, tobacco-free generation, and stop all current sales of tobacco and replace them with very low nicotine cigarettes. So we did the modelling on that, and it showed an extraordinary, there's my finger there, that's Māori's mortality rate, non-Māori mortality rate, both coming down over time. And under this intervention, they both come down faster, everyone's a winner, but the gap between my fingers closed 25%. 25% closing in the gap between Māori and non-Māori females in mortality in 20 years' time. Never seen anything like it. So that is really powerful information because that actually empowered the whole thing. Legislation got passed in December 2022. New Zealand was the first country to do a proper end game thing. Then a new government got elected and completely stuffed it up and repealed it. But anyway, it did neatly get across the line. And that modelling showing the inequalities impact was incredibly powerful because it was largely the Māori constituents and their political representatives that were really driving this. So hopefully that gives some insight there.
Very interesting
Just-
perspective.
Can I
Yes,
just
Joe?
add to that
Yeah.
as well? Because I mean, it came up a little bit earlier as well, that sort of sense of needing to build a constituency. And if you think of, the research and the policy sort of areas, there's also that sort of sense too of the need to sort of build that public demand to support and to help politicians make the what they see as very difficult kinds of decisions because they don't feel they have the social license for it. And so it's an area of work in the prevention space that we've talked about for a long time, but I don't think we've really nailed it. And I feel like I'm rabbiting or I'm parroting Penny Hoare in saying that, it is a gap for us is building that public demand for prevention in the same way that we have for health services as well. But to get those big policy changes,
I completely
have to have that public support. You really, really do.
And that's where we have a role, Joe, I reckon, because, we didn't get asked out of the blue to do this modelling for the New Zealand government. We had been speaking to this for 20 odd years.
Yeah.
And we had slowly been making what seemed outrageously radical more and more possible. And, that's the long game you're playing. Or in Simon Chaplin's words, often public health has been pecked to death by ducks. It takes lots of little things to then get a big thing happen.
Yeah, and the other comment that I'd make, which I think is sort of relevant here too, is that Adrian Bowman once said that government works at two speeds, glacial and the speed of light. And it just resonated with me so much. It's so true. It's sort of that sort of step by step, and people get really frustrated, well, public health people get really frustrated by that. But then it's the boom, I need it now, which I see Miriam's put up a question around some of the barriers, and certainly for in my experience, one of the barriers is that when it's a speed of light question answer that you need, modelling is not a speed of light response.
Yes.
And so that is an issue, and it's also expensive. So with the obesity model that we did, we did it quickly. We did it, but it was 3 months, and when government's on a speed of light trajectory, that's too long. But we did it in 3 months, which was great, but it's expensive. And so it's that thing of, oh, gee, and especially in, post-COVID, that the fiscal environment's so tight that I think that would make it even more difficult as well. So I'm interested to hear about that sort of concept of having platforms sort of almost ready to go, which can then get contextualized as well for particular areas, because people are pretty parochial still and still want to sort of have some way of seeing it that does this work for New South Wales? Probably work for, if it works in Queensland, it'll probably work in New South Wales on a grand scale. I mean, obviously you want to contextualize as well. So I think that's one of the big barriers that I see in active adoption and actively commissioning in the non-COVID era, particularly around the chronic disease prevention space too.
Thank
And
you,
just
Danielle.
just to add to what Joe said, I think and I can resonate so much with that, glacial and speed of light analogy that you mentioned, because that's been my experience. But I think one of the values of, and kind of bring back to the alcohol modeling that you talked about, where, it didn't have impact on changing a particular policy. But that's one of the ways, the sneaky ways, I think that simulation modeling and modeling in general can actually have impact, is it starts to lay those seeds in people's minds and the way they think about problems and changing the way they think. And maybe in that moment it didn't change alcohol specific policy for right there, but I bet the people who were involved, you being one, it changed a little bit of the way you think, and it prepped you for the next time to do a simulation model on something different, or just to think differently about a problem. So it has this sneaky way of slowly infiltrating. And like Tony said, it's after 20 years of, slowly banging this hammer that bam, things come out. And then that really segues into the COVID work, because I think this might be the case with Tony as well, but at least for the COVID related modeling that we were involved in, it was built off of existing, it's off of existing modeling infrastructure that we had used for something else, and then started to we're able to mobilize much more quickly. So investing in that infrastructure before we need it allowed for it to be used and modified and used in different cases. So it wasn't necessarily built for COVID, but having models, we did a lot around ICU capacity and hospital flow and capacity. Having those existing pieces that we were able to then rapidly mobilize help build the ability for modeling to be used. But it's just still so new. But I do hope that this has started a bit of a wave, that as we build more models and have do more drum banging, as Tony was alluding at, we start to have more stuff in our arsenal that we can then mobilize more quickly to be able to help both the glacial and the speed of light decision making. But it is very hard to do DSM in a speed of light. You can do it in 3 months, but it's hard, it's expensive, and it's tiring, and not the ideal way to do it. So yeah.
So just to reiterate Miriam's question to the group, what do the panel members think are the biggest barriers to using systems dynamics models? So Joe has mentioned that it is that time, it's expensive, but Danielle has said that if you do have that structure, and Tony's also elaborated on that, is that they can be adaptable. So it really depends on, I suppose at this point, the policy issue that you're grappling with. And so Miriam's follow-up question is there a condition that needs to be present for it to be used effectively? So this refers to modeling. Any insights and thoughts on that?
A champion. There needs to be someone on the decision-making space who believes in it. And I think that's where the line between the academic type of modeling and then the modeling for policy works. There's a lot of modeling that's done in academic space, but unless there's someone with a real problem that is in a place, is ready to do something about it, it doesn't have the same level of impact, and it's not going to be so successful.
Yeah, and I'd also say that sometimes policy, I'm glad there are policy people online as well, because I'm a real advocate for policymakers, because sometimes policymakers are seen to be like an evidence-free zone, and it's not the case. But like Tony said, that he's a policy entrepreneur. I think policymakers are also like the brokers between the evidence and the art of what's possible in terms of the politics as well. So that's really important. And I think one of the things from a policymaker's perspective as well is that sometimes some of the solution generation stuff, it's sound, but it's not feasible in terms of how it could roll out to be a statewide approach or a Australia-wide approach, and being able to actually practically happen in a health system as well. So that policy perspective is important from a politics perspective, but also in terms of solutions that are going to be feasible in a health system as well. So that's important too.
Joe, that's great insights. Tony, would you like to add your thoughts to that question on the barriers?
There's a lot. I don't want to. I think a lot's been said already. I would say another one is return the gaze on ourselves a bit, is the validity of our models. I think there's a strong onus on us to make sure that they are valid, that we're trying to test them, that we're doing things like finding researchers around the world who are doing a similar thing, and we compare our model to those so we understand the weaknesses. One of the currency of academia, the currency of research, is that we're trusted as experts. And we don't want to be in the game of fueling mis and disinformation ourselves. So we do have to look at ourselves. Now, I'm not saying that we're not doing that, and I'm not, there's been a lot of other good comments. I'm just adding that extra one there of really making sure that we are doing the best we can to validate, calibrate our models, that we're transparent about the limitations, that we don't overstate them. Yeah, I'll stop there.
I think science communication, yeah, I guess the last point, I think putting greater focus, we as a modeling community need to get better at science communication and communicating to audiences that don't know a lot about modeling, just as Tony mentioned, to improve the transparency of what we're doing. They're not crystal balls, and so you really have to interpret them in the context of quite a bit of it, of information. But there's so much use, but it's not a crystal ball. So getting better at,
and they're not magic as well. There's a sense of, oh, it's magic. You put something in. I like that comment, garbage in, garbage out. I think we've been talking about that as well. But there is a sense of like, oh, how it's kind of like that's why I like the glass box analogy as well, so that you can actually see and interrogate and unpick as well.
I really like that, Joe. Your black box becoming a glass box. I'm going to use that next time.
that actually came from the modelling that we did in the alcohol, so the first one that we did, and I should actually say that it was John Wiggers who used that terminology, which I've adopted.
Oh, well, I'm going to steal it again.
Right.
Thank you, Joe, Tony, and Danielle. We have surprisingly come to the end of this panel discussion. Look, time just flew by. There's so much more to say, so many other thoughts to add to this conversation, but it was great having the three of you on board. I'm sure people have learned a lot today, our participants. So I do encourage, if you have any questions from follow-up questions from this conversation, you can reach out to me or the Prevention Center or any of our panelists for further insights. And please do have a look at the report, read the summary as well if the report is too big for you. And we also have the policy brief. So all of those products would help answer further questions as well. And you can continue to be engaged with the Prevention Center through Emerging Leaders Network's future webinars and our communities of practice as well. And if you have colleagues who would like to join, please ask them to head to our website and sign on to the network as well. So thank you again for your time today, everyone. We really appreciate it, and we will see you next time.